Hello, and today I am talking with Jeremy Mullin and Philip Parker of Coral Health. Jeremy is the VP of Corporate Development, and Philip is the Chief Operating Officer. And I wanted to speak to them because I found the blockchain company that they are working on, Coral Health, to be extremely interesting when it's covering healthcare issues, and especially in the United States. Even after the Affordable Care Act was passed, there's still enormous healthcare problems that have been well documented. Premiums are still going up, and there needs to be some kind of resolution since it's not coming from Congress currently. And that's what brought us here today. And I would like to thank you both for agreeing to talk to me.
Thanks, Walter.
Pleasure. Thank you, Walter.
And to lead off, the first question, because this concept is so interesting, and blockchain is somewhat new to the mainstream still. What motivated the company to, for one, to be a healthcare company and to move in this direction? We can start with Jeremy.
Yeah, thanks, Walter. So the core management team of Coral Health, we've known each other for quite a while. We've all been involved in the healthcare space for quite some time. So I believe amongst myself, Philip Parker, our CEO, Andrew Park, and our Chief Scientific Officer, Alan Ma, we have about a collective 30 years plus experience within the healthcare space. So we worked in various roles, myself in consulting within the space, market research. Andrew Parker, CEO, has been a healthcare technology entrepreneur himself. Philip, who can fill you in more on his background, has been involved with Athena Health and the emergency health records space in the U.S. And our Chief Scientific Officer, Alan Ma, is a PhD in molecular biology, and he's worked in business development roles in the space for a diagnostic company. So there's just a lot of experience. We know the space really well. We know the challenges in healthcare. We know how these issues related to data exchange have plagued the industry for some time, and we're hoped to have been solved with the adoption of emergency health records, but we still find, of course, unfortunately, that data is still very much siloed, centralized in a vulnerable state, non-encrypted in many cases, and we've just with the rise of blockchain technology, we're finally provided an answer for a lot of these intractable data exchange issues that are plaguing healthcare today.
And I think that's one of the big intriguing factors about healthcare industry. A lot of the cost comes down to data keeping and keeping records. Is that something that you feel like the overhead cost that can come down extremely with blockchain while keeping patients' information safe?
Absolutely.
Yeah, for sure. So just to speak to that, I mean, doctors are spending 40% of their time just processing paperwork. And that largely has to do with the fact that the fax is still the primary way of exchanging information. So what we have with your electronic medical records today is, essentially a system where data is siloed. Your record exists in a fragmented state at every single doctor that you've seen, but no one has a complete view into your record. And because of kind of the security aspects that are so important in healthcare, until the blockchain came about, doctors have really relied on the fax up through today to securely transfer data, but that's incredibly manual. You both have to take it out of your EHR system, send it to another entity, and then that entity has to enter it into their system. So the blockchain presents a fantastic opportunity to remove a ton of this manual work in our system and move towards a much more automated, streamlined process where doctors, don't have to spend their time filling out paperwork. They can instead spend their time seeing patients like they want to be.
And since this is such a big portion of the news right now, with the issues of online and digital safety, with everything that's going on with Facebook, what can you speak on? One of you speak on how blockchain kind of is a lot more secure, and how data is controlled in that environment in a more secure fashion?
Sure. Yeah, I'm happy to take that one. So the way that we securitize data right now in our system is essentially the moment data is uploaded, it's encrypted. And the only entity that can access that information is the entity where it originated, because that's the only place with the decryption keys necessary to interpret the data. If anyone were to hack the data, say from a central server, you wouldn't be able to view any of the information. It would be completely unintelligible. So what Coral Health does is it's created a system using the blockchain where data is fully encrypted and unencrypted information is never sent in transit. So there's not really a potential to hack this data. The only vulnerabilities are on the originating device and on the patient's device. And speaking towards kind of, the Facebook issue of, consumer information kind of being passed around by different entities and no one really knowing how their information is being accessed, how Coral Health deals with that issue is we help the patient kind of reclaim ownership over their data. So it's the patient that's delegating who they want to have access to this information, and they'll be able to easily see a complete view of who has access to this data, and they can revoke that access at any time. So it's really about, moving from this system where your data is bought and sold, and you have no idea about how it's being used, to a system where the patient's in control, and people only have control when they've been specifically delegated by the patient.
This might be more of an in-depth question, but for those who are not experienced with technology, will the learning curve be steep, or is it extremely intuitive when you start looking around and just a few button clicks rather than a long tutorial needed to do that, especially with some of our elders right now who didn't grow up in the digital age that might not be familiar with this kind of technology?
Yeah, absolutely. And that's not a trivial point by any means. Any adoption, large scale adoption has to be has to have a significant focus on, usability and so forth. And especially when you're dealing with older populations that aren't necessarily as tech savvy as some of the younger folks. And so we've put a lot of thought into that. We've actually built a mobile app demo that folks can access. It's very, very simple and very straightforward. It's going to be extremely simple for somebody to use, and of course we're going to support that with education and so forth around how to use the tool and so forth. But it's a non-trivial question for sure. Smartphone adoption is increasing every year amongst the upper baby boomers and 65 plus bracket, and around 50% of folks that are under 75 have the ability already to download a simple app and use it. So we're banking on that increasing. However, also what's very important to note is that, as we get critical mass, or even as we get a substantial, patients within the ecosystem, it doesn't have to be anywhere near, 100% of the population of the universe using the applications to start deriving, significant value from day one. So we start at, in the single digit percentage, 5%, 10% and so forth is still a victory. It doesn't have to be everybody using the app, but we do envision it, sort of groundswell of support over time, building and so forth.
Yeah, and just speaking to that point, the process that we have today of manually pulling this data from databases and faxing it to each other, it's so inefficient. So as Jeremy's saying, just even small amounts of adoption help to make the system much more timely and cost effective than it is today. And we've all that encryption and that I've talked about, we've as Jeremy said, we've abstracted that away entirely. So all you're seeing on your app is, I want to share my information with my doctor, and everything else in terms of encryption is handled on the back end. So let's say you're an older patient. You don't need to understand how the system's working unless you want to. all that is abstracted away, and you can kind of have this smooth interface that doesn't rely on knowing how the data is actually being secured.
Yeah, and another point I would add to that, a final point, is that we are also providing the ability for the patient to put their trusted, primary care provider with the ability to be able to share that their information on their behalf. And so if somebody's like an elderly patient that isn't able to control that using a smartphone, they can opt to bestow that privilege on their trusted family doctor to be able to send that information to an insurance company, for example, on an as needed basis on their behalf. And so that coupled with the fact that you can control it yourself if you opt to, will expand sort of the usage as well, and cover those people that are less familiar or less willing to rely on downloading an app and using it themselves.
And I think with the current lack of, I guess, moving in a correct direction to ensure the entire population of the United States, how do you envision Coral Health working within the bounds of what could be a dramatically changing healthcare system over the next decade?
Yeah, so the way we see it fitting in is really using our blockchain applications to fit ourselves into the operational workflows of our partners. So for example, with Principal Health Systems, one of our first partners that we're piloting our program with in about a month, what we're doing with them is essentially providing them with a much more cost-effective, secure way to exchange data with their patients. So it actually fits in quite seamlessly with their own operations. And then once we've kind of given patients access to their lab information through our app, we can then leverage that information to start automating a whole nother set of processes. So we can take that information and start reducing the amount of work that doctors are doing. So right now, take, for example, prior authorizations. It's an incredibly manual process where doctors are handwriting out patient information onto these prior authorization forms, faxing it over to insurers. Insurers have to then go through, match up these faxed forms to that patient's particular medical policy and try to figure out whether or not the patient qualifies for that, say, drug or therapy. So what we're able to do is use that patient data that we're getting just as a process of streamlining and replacing the fax for our partners. We're able to then help the patient use that information to get an automated prior authorization where essentially we take the insurer's medical policy, programming it into these programs called smart contracts on the blockchain, and have that parse the incoming data coming in from the doctor. So we can essentially fit ourselves into the operational workflows of our partners and then provide a lot of incremental value on top of that after we've replaced kind of the inefficient data exchange processes that exist today.
So you would be able to, the app itself and Coral would be able to exist in any healthcare system around the world. For example, if we looked at some of the Scandinavian approaches to healthcare where there is basically no insurance companies, you would still be able to exist within that ecosystem, and it would still take away the overhead that those doctors also have to deal with.
Yeah, exactly. So there's two different issues, at play. There's the insurance side, and that's a little bit more unique to the US where we don't have a single payer system. But then in addition, there's just the general lack of a patient medical record. And that lack of a patient medical record, it's an issue across pretty much every single health system. So a lot of our team is actually from Canada as well. And one of our first partners, Fraser Health, is a large Canadian health authority. And they have the exact same issue that exists in the US where data is very fragmented. It's not getting into the right hands. So let's say the community health centers treating some patients aren't sharing that with the emergency rooms, which makes it very difficult to treat patients that are coming in off the street. And so this issue of data exchange, it applies to every single country. So no matter if you have a single payer system or not, we're able to help you get better access to information and help make sure that you get that information in far more real time than you can today.
And is there any because that sounds incredible. Because I've heard stories just from people I've spoke to that have had issues with that very process. I spoke to a veteran about that, and at the VA, even where it's passing along information from just one part of the VA's office in the same building is sometimes difficult, and something like this would streamline that completely to be down to almost the click of a button. Is that a correct, pretty much, I guess, accurate estimation of how that would operate?
Yeah, that's definitely the vision, and what you're describing is like very, very common. Like different departments within hospitals even have difficulty sharing data. For example, like if you have some sort of like ankle injury and you go to, you get X-rays done, just being able to share that information from, the imaging department with your physio department can be difficult. And a lot of that is just because, you have siloed systems not talking to each other, if you will, or like disparities in terms of the structure of the data. But a blockchain in those type of scenarios is like a perfect solution in the sense that, all the information can get written to one decentralized ledger, and then everybody's be able to access that and share that information as needed, right? In a permission based manner. So there's, even outside of like the direct patient benefit, being able to control the data, there are just, literally hundreds of different use cases in the healthcare space for blockchain to be able to improve data interoperability and just, streamline operational efficiency across the board.
That sounds like that sounds like something that a lot of people, especially around the United States, would be happy to hear, especially with a lot of the issues that have been going on over the past 30, 40 years. Do you expect, as a company, any kind of pushback from any lobbyists within the United States, or any kind of, I guess, campaign against moving to blockchain, or any kind of unforeseen circumstance like that?
Yeah, I would actually say the healthcare industry has been remarkably receptive, from large payers like Humana, United Healthcare, to, large pharmaceutical companies like Pfizer. There's actually been enormous openness. And we saw this just last week when Humana, Optum, and Quest Diagnostics, as well as a few other large companies, got together and said they're actually going to apply a blockchain solution to provider credentialing. So that's a big issue right now in healthcare, where every single entity has their own directory of providers saying, here are their credentials, here's where they live, here's where they practice. And these large companies are already getting together to use a blockchain solution to build one central directory for that doctor information. So I'd actually say, it's still a concern, but to this point, there's been tremendous openness, both on the part of small companies as well as large industry players, to adopt blockchain solutions. And really what they're looking for now is just, startups in the blockchain space that can help guide them in terms of how they can apply blockchain solutions to help their organization. So I think the tremendous operational benefits that they kind of see from applying the blockchain are kind of offsetting these sort of concerns that might lead to lobbying.
Oh, that's definitely sounds to be a huge bonus there. Well, even as we get close to wrapping up, the overhead price for the consumer here, especially within the United States, since we are one of the only developed countries that might be the only developed country that does not have a single payer system, will consumers be able to see that price relief, especially when they're dealing with chronic illness, or unforeseen injuries like car crash injuries, or unfortunately gunshot wounds, things like that?
Yeah, we're hoping that's the future state, Walter. So just to give you some idea, there's $1.3 trillion worth of waste quantified in the U.S. healthcare system, and a lot of that stems from data interoperability issues. If you just focus in on data breaches, for example, like the one with Equifax, although or a healthcare one in the healthcare context, the Aetna one. That's costing the healthcare industry over $6 billion a year just related to data breaches. And then thirdly, big pharma is spending $50 billion plus a year trying to recruit people for drug trials that are necessary in bringing life-saving drugs to market. And most of the time, 80% of those recruitments fail. And so there's just a tremendous amount of cost in the system that really stems from not being able to share data in a really seamless way. And so if we can bring blockchain technology to bear on a lot of these contexts, we can drive, we can eliminate or take a big bite out of that, 1.3 trillion in waste a year. And the long-term, benefit of that would be that if, insurers and pharma companies can operate more efficiently, then theoretically, cost savings should be passed on down to the consumers, right, over the long run.
Yeah, and one of the biggest costs in addition to that is just the cost and time to the patient. When you have a chronic condition, you're spending enormous amounts of time, trying to get your data to the right doctor at the right time, trying to get your prescriptions filled, going through these prior authorization headaches. So, a blockchain solution is fantastic for the patient just in terms of helping them save time, helping them have access to their data so that they're not wasting so much time going to different doctors and trying to get access to their own information. So I would say, long term, we see the costs being driven down for the patient as these operational efficiencies take effect. But in the short term, it's just a tremendous time savings to the patient. And it also really helps those patients get the personalized care they need because, if a doctor doesn't have access to their information, it's incredibly hard for those doctors to actually help those patients with chronic conditions and coordinate their care across their different providers.
Okay, and that's definitely great to hear. I did not know the waste within the industry was $1.3 trillion a year in the United States. That is an absurd.
It's almost a third of the total spend. It's ridiculous.
That's definitely something that needs to change immediately. And I'm a big proponent of blockchain technology for everything from voting to healthcare to video games. Everything it can be used for everything to take care of security measures and evidently get rid of a lot of waste because that's a gigantic number. And before we close up, is there anything either one of you would like to say to close to speak about Coral Health and your vision for the future?
You want to take that, Phil, or you want me to?
Sure. Yeah, I can take that. Sorry, I was on mute for a second. So, yeah, I would say that, really what we see as the future of healthcare is a connected healthcare system where everyone that's trying to treat you has that real-time shared access to validated healthcare information. So for Coral Health, we see data as kind of the tremendous, just as having a tremendous amount of value in healthcare. And we haven't even scratched the surface of what's possible in terms of personalizing care at this point. So as we work and apply the blockchain to healthcare, we can move towards a much more personalized system that's far better for the patient and far more cost effective. So if you're interested in learning more about Coral Health, you can check us out at mycoralhealth.com. We also have our white paper on our website there. And just to say, if you're in industry and you're thinking about how you can apply blockchain to help your company, come talk to us. We've chatted with a number of organizations at this point, from large payers to large health systems, and we're really eager to help you learn how to apply blockchain and to help you improve your organization.
And that's great advice, and I appreciate both of you taking the time to talk to me. And I probably will definitely reach out in the future because this is a great technology that I think can help save lives, to be quite frank about it. So again, I appreciate your time and thank you very much.
Thank you, Walter. Our pleasure. Anytime.
Thanks, Walter.